Assalamualaikum and good day, ma'am. I am Motalib Johanah. Today, I'm going to perform the assessing of the mouth and oropharynx. Assessment of the mouth and oropharynx involves a physical examination of the oral cavity, including the lips, teeth, gums, tongue, and throat. This assessment is crucial for detecting abnormalities like infections, lesions, signs of systemic diseases, or oral cancers. So the purpose of this is to evaluate the oral health of the oral cavity and pharynx and to identify any signs of oral conditions, to assess the function of the tongue, teeth, and the ability to swallow, to screen for systemic conditions with oral manifestations such as dehydration, malnutrition, or infections. The equipment is pen light to illuminate the oral cavity and oropharynx, tongue depressors to help depress the tongue and provide a clearer view of the truth, gloves for hygiene and safety during the examination, disposable spatula or gauze pad to assess and manipulating the tongue or other structures. Considerations: patient comfort. Ensure the patient feels comfortable at ease before proceeding with the examination. The mouth and throat can be sensitive areas for some patients. History: gather relevant information on symptoms such as sore throat, difficulty swallowing, changes in taste, dry mouth, or any previous dental issues. Also, inquire about smoking, alcohol use, and oral hygiene practices. Cultural sensitivity: be respectful or cultural preferences related to oral hygiene practices as well as attitude toward physical touch. Infection control: always use gloves and maintain strict hygiene standards to avoid cross-contamination during the exam. Visibility: in some cases, using a tongue depressor and a pen light will provide a better view, especially for the back of the throat and tonsils. Things to document after the procedure: lips and buccal mucosa, condition of the lips, color, hydration, presence of lesions or cracks inside of the cheeks. Note any lesions, color changes, or ulcer. Teeth and gums: teeth condition, not missing, decayed, or damaged teeth. Gums: check for swelling, redness, bleeding, or receding gums. Tongue: observe the size, texture, color, and mobility. Look for any abnormalities like cutting, redness, lesions, ulcers, or white patches. Things to document after the procedure again: palate and uvula. Examine the hard and soft palate for abnormalities such as lesions or cleft palates. Uvula: observe for symmetry and check for its movement. When the patient says it should rise symmetrically in the midline. Oropharynx and tonsils: inspect for redness, swelling, or exudates on the tonsils and pharynx. Check for enlarged tonsil or lymph nodes. Note any pain or difficulty when swallowing, as this may indicate infection or inflammation. Hydration status: look for dry mucous membranes in the mouth, cracks, lips, or tongue as a sign of dehydration. Breath odor: document any foul smelling breath which may indicate infection. Poor oral hygiene or systemic condition like diabetic ketoacidosis. Speech and swallowing: observe if the patient has any difficulty with speech or swallowing, which could indicate neurological or structural issues. Overall oral health: check for signs of oral cancer, persistent sores, lumps, or unusual discoloration that do not heal, and document any usual findings. Good morning, sir. I am Johanna, your student nurse today. Today I will be assessing your mouth and oropharynx. So is it okay with you, sir? So, assessing the mouth and oropharynx: inspect the outer and inner surface of the lips, noting symmetry of contour, color, texture, and lesions, and ask the client to purse his lips. Variation in color and texture may indicate poor nutrition, dehydration, or hypoxia. Lesions may indicate herpes simplex or other contagious skin infections. Inspect and palpate the inner lips and buccal mucosa for color, moisture, texture, any presence of lesions. Careful inspection may reveal nodules, lesions, and first signs of mumps and measles, and ask client to open his mouth for clear view of oral cavity. Remove danger if any. If able, you may ask the patient to his inspect condition in feet to detect for feet or irritation, and inspect teeth and gums for discoloration and disease or missing teeth, to check for disease or missing teeth.
Inspect the roof of the mouth for color and structure, and inspect all surfaces of the tongue and the floor of the mouth.
So, ask the client to protrude his tongue, inspect the upper surface for color, texture, and position, may reveal signs of vitamin and mineral deficiency. Beefy red tongue and indicates vitamin B12 deficiency. Next is have the client place the tip of his tongue in other roof of his mouth. Use a pen light and inspect the other side of the tongue, frenulum, floor of the mouth, and submaxillary glands. Reveal surface presence of veins and saliva to visualize any oral malignancies that develops in the area under the tongue. Saporo. Next is ask the client to roll his tongue upward, downward, and from side to side to check tongue movement, to assess tongue mobility. Wear gloves and palpate the tongue and floor of the mouth to feel for masses or tenderness. Isa. Baba. Baba. Ha. Poro. Ha. 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 With the use of a piece of gauze, pull the tongue to the left and examine it, then do the same to the other side to reveal lesions or patches on the sides under the tongue where malignancies are common. Ask the client to tilt his head and open mouth as wide as possible. And the next, use a tongue depressor and shine a pen light into the oropharynx to inspect deeper structure.
Inspect the hard and soft palate and tonsils. Note the color, shape, texture, and condition. To observe color, shape, and texture. Inspect tonsils for color, ulceration, exudate, and enlargement. Test the gag reflex by touching the back of the soft palate with a tongue depressor.